how do you see hypermobility or EDS impacting pelvic organ prolapse?
Working before. So in folks with EDS, they're going to have a twofold increase in pelvic organ prolapse as compared to the general population. And so with that, we know that our pelvic organs, our bladder, our rectum, uterus are supported by connective tissue, which is made of collagen. And so in these folks, the collagen is not strong enough and it's not supporting things. So, like I said, they can have prolapse of any of those organs. And with that, they can have the symptoms Erica talked about. They can have stress incontinence, urge incontinence. They can have incomplete bowel emptying. They can have constipation. They can have diarrhea. So they can present with like a range of symptoms. And specifically in people that have EDS, like these symptoms are more impactful when they're under the age of 40. Like if we have a patient that comes in and is 25 and has a rectal prolapse, we have to ask the question of why, right? Versus like if somebody is postpartum and has a uterine prolapse or somebody is menopausal, it makes a little bit more sense versus somebody younger having a prolapse. It raises, flags and questions of what's going on.
That's really an amazing distinction, right? Of that age can give you so much information to start asking different questions. And
Yeah.
I'm seeing this a lot in the chat. So this is kind of a Q&A, but also part of our question. I'm curious, when you're looking for these experts or you're trying to find people that have this expertise, what should patients be looking for? Are there qualifications or trainings or directories that qualified pelvic or ortho PTs are a part of?
I don't know if there's an EDS society of physical therapists. There should be. But I know for pelvic floor, there's the American Physical Therapy Association has a women's health section. There's also Pelvic Guru has a list of providers, as well as Herman and Wallace has a list of providers. And the reason a pelvic floor PT is better suited, I think, to help folks with EDS is because so many of these patients have all those pelvic floor symptoms. So they're able to treat that with manual techniques, biofeedback, use of the rectal balloon, but then they can also really work on like slowly graded exercise with the appropriate intensity and weights versus like your average PT may progress the patient too fast and then they could get injured, they could dislocate things. So, I really think a good pelvic floor PT with an understanding of the pathophysiology would be the way to go. And maybe we need a list for the EDS Society of PTs. We can work on that.